Okay, I'm Jimmy Jones with the Eastman Examiner, and I'm here today with Jimmy Lewis. And Mr. Lewis, what organization you with?
I'm with Hometown Health. I'm the CEO of that hospital organization. We have 56 rural hospitals that we represent, and our primary mission is to do whatever we can to keep a hospital in rural Georgia open and going and viable.
Okay, wonderful. The Dodge County Hospital sponsored this town hall event tonight and asked for you to come speak to the citizens and explain the situation that we're in, if what I understand is correct.
That is correct. That is correct.
So what do we face as a community?
As a community, as a nation, we face a transformation of healthcare, the likes of which we probably never expected, because of the expense associated with healthcare and the fact that our gross domestic product had approached 17 to 20%. We were out of control. Our Congress had recognized that had to be dealt with. Our president recognized it had to be dealt with, and we have since seen a number of measures put in place. We saw Obamacare come down the pike and it get passed. A lot of opposition to that, and I'm not to debate whether that's good or bad. Rather, the impacts of the changes associated with Obamacare and whatever else would have happened because of the debt situation and expense situation. We're about to face a transformation of healthcare that's going to be unmatched in our history. We had become quite accustomed to a very favorable healthcare system that we like. We can't afford it. We're changing it, and we're changing it more by pressure from the outside than from the inside. We're going to change it because of the way our healthcare is delivered, whether it be in hospitals or telemedicine or whatever the case may be. We're going to find a lot of other things that are coming down the pipe that we never expected, and we're going to have to deal with those. The biggest thing that we're going to see is just a total change in all of our health care and how it will be delivered in hospitals and through docs and that kind of thing. And it's all a function of what we can afford, and we're seeing this played out, and it's going to play out in every facet of our life, whether it be on the state health benefit plan through Blue Cross or whether Cigna, United, any of those people. So in preparation for that, a town hall meeting like this is offered to provide education so that we can indeed start to get people on notice that major changes are about to occur. It's going to occur at three levels. It's going to occur at the federal level, at the state level, and at the local level. Ultimately, what it'll all boil down to is many rural communities are going to have to make some serious decisions about how they support their healthcare systems. Hospitals such as this, the ultimate unfunded mandate will require a community to have to decide how they want to pay for it, if they can pay for it. Unfortunately, we just had 2 hospitals to close in the early part of the year, and their communities just determined that they just simply didn't have the wherewithal to pay for it. It's a very difficult decision. It's a community decision. It's a cultural decision, but it's a decision that in many cases is imminent. In the hospital such as you've got here, you got a great community, you got a great hospital. It's suffered the pains and agonies of this whole transformation, and it's made a lot of the changes that are necessary to make this a successful conversion. But some of this is going to be out of the control of this local institution, and it's going to come to an unfunded mandate that the community is going to have to deal with. So there'll be a lot of other alternatives that will come online. We'll have to become adaptive to those, whether it be telemedicine or telemonitoring or those kind of things. But for the most part, we as a community are going to have to decide what we want, how we want to pay for it, or whether we just want to drive a long way for health care and suffer the consequences.
All right, great. Thank you very much.
You got it.